If you understand what happens during a heart attack, you will never forget it, and you will never miss it in the ward or during exams. So now, let's dive in and know what heart attack is and what happens during the heart attack. Now, the definition. Heart attack refers to a condition characterized by restricted blood flow to the heart muscles, or you can say heart attack is a medical condition characterized by restriction or blockage of the coronary arteries. The coronary arteries are the arteries that supply blood to the heart muscles. So now when you look at the systemic circulation, you find out that the aorta sends blood to other parts of the body. But then a portion of this blood is reserved for the heart. So what the coronary arteries do is to take that blood and circulate it all over the heart muscles, which is also known as the myocardium. So in myocardial infarction, a part of those arteries is either blocked or restricted in such a way that there is less blood flow to the heart muscle. So think about this scenario. In a heart attack, there is less blood flow, and because there's less blood flow, there will be decreased oxygen supply, and because there is decreased oxygen supply, there will be an increased oxygen demand in that part of the heart, which will lead to symptoms like shortness of breath. Now let's talk about the causes. The major cause of myocardial infarction is a blockage of the coronary arteries. And what could block the coronary arteries? Plaques, like fatty deposits. So when there is a fatty deposit in the coronary arteries or any part of the body, it could travel to the coronary artery and block that artery. And when this plaque is found in the arteries, it could rupture and form blood clots. Now, these blood clots can also occlude the artery or block the artery in such a way that there won't be blood flow to that part of the heart, which is known as the myocardium or the muscles of the heart. And when this happens, it's myocardial infarction. Now, there are risk factors that contribute to the formation of these plaques. And for this video, I'm going to be dividing them into modifiable risk factors and the non-modifiable risk factors. The non-modifiable risk factors are the ones that are beyond our control. We talk about things like advance in age, talk about being male, or having a history of heart disease in the family. So if a person has these three factors, it increases his risk for developing myocardial infarction. Now, let's talk about the modifiable risk factors. These are the risk factors that if you take them away, the risk for developing heart attack reduces, and these are smoking, sedentary lifestyle, or lack of exercise. You talk about stress, you talk about alcoholism, poor diet that is made up of unhealthy fat that can occlude the arteries, being obese, or even being diabetic or hypertensive. This could lead to myocardial infarctions. If you or any of your patients have any of these risk factors, it is very necessary that you manage them so that it's not going to cause myocardial infarction for the patient, because myocardial infarction is a medical emergency. Now, let's talk about the signs and symptoms of myocardial infarction. Now, the most popular sign of myocardial infarction is chest pain, especially when it radiates to the back or down to the arm or even the elbow, especially the left side, although it may affect the right, but in most cases it affects the left side. This is the classic sign of myocardial infarction. Other signs you can see are shortness of breath. You can also see night sweats or the patient will be having cold sweats. These are signs that the heart muscles are crying for more oxygen because there is less blood supply to them. You can also see symptoms like fatigue, nausea, and vomiting. Those are other symptoms that could accompany the major symptoms of heart attack. Although in most cases, these heart attacks do not show symptoms until it has eaten deep into the heart. That is when the patient will now start seeing symptoms. So it is important that you manage your patient properly and remove the modifiable risk factors so that the patient will not develop myocardial infarction. Now, there are some diagnostic evaluation that could be carried out to confirm that this patient is truly having myocardial infarction. And the first one you want to talk about here is the electrocardiogram. The electrocardiogram is a diagnostic test that reads the electrical conduction of the heart. So abnormalities in the waves of the electrocardiogram can tell you if this patient is having myocardial infarction or not. There are other tests like the cardiac biomarkers, like the troponin and the creatine kinase MB. Now, these biomarkers are indicators of myocardial infarction. So when a test is done and there is an increase in these biomarkers, it shows that there is a recent myocardial damage. So because there's a recent myocardial damage, these cardiac biomarkers will increase. So when you see an increase in these cardiac biomarkers, you know that there is a recent myocardial damage. So you can use it to confirm the diagnosis of myocardial infarction. Now, how do you manage this condition known as myocardial infarction? For the acute management or in an emergency situation, you want to use the MONA approach. Now, this MONA approach is an acronym used for the 4 steps used in managing acute myocardial infarction or in emergency cases. The M there stands for morphine. Morphine is an opioid analgesic to reduce the pain the patient is having. You also talk about oxygen because there is reduced oxygen supply to the heart and increased oxygen demand in that area of the heart. It is very important that you supplement this patient with intranasal oxygen. And then we talk about the N. The N there stands for nitrates. We have nitrates like the nitroglycerin. It is a sublingual tablet that the patient can take to help reduce the load of the heart. That is to say that it helps to dilate the coronary arteries and increase and improve blood flow to the cardiac muscles. And the A there stands for aspirin. Aspirin is an anticoagulant, so it's going to prevent the clotting of blood in the heart, which could complicate the myocardial infarction. Now, remember that when there is a plague, it could rupture or cause a rupture in the blood vessel, which will lead to blood clot formation. So, to prevent this, you are going to use aspirin. Aspirin there also is a non-steroidal anti-inflammatory drug that could be used to manage pain. So, the morphine and the aspirin treat the pain, while the aspirin also prevents blood clots from happening. Now, there are other medications that could be used at this point, which are the beta blockers or ACE inhibitors. What these medications do is to bring down the blood pressure. The ACE inhibitors reduce the blood pressure in case this patient is hypertensive. The beta blockers also reduce the blood pressure and also reduce the force of contraction of the heart so that it can relieve the symptoms that this patient is having. Now, lipid lowering drugs like the statins, talk about statins like the atorvastatin, simvastatin, and others. These medications could be used to manage myocardial infarction, especially if it's caused by plaques or hyperlipidemia, when there is too much cholesterol in the body. These drugs will help to bring down the cholesterol so that it's not going to form excess plaques that will complicate the issue we are already having. So as a nurse, it is your duty to monitor this patient's vital signs and also to monitor the ECG machine to find out how the electrical conduction of the heart is going. It is also your duty to advise these patients on diet and lifestyle modifications. We talk about diet like reducing salt intake, reducing unhealthy fat and highly processed food. We talk about exercise, but this exercise has to be mild. Talk about exercise, quitting smoking and alcohol. These are going to help the patient to reduce the modifiable risk factors of the myocardial infarction. You should also educate the patient about the warning signs of myocardial infarction and educate them on strict medication adherence. They should not skip their medications on no account so that the management of this myocardial infarction will be proper. You don't want them to miss any dose of their medication because missing a dose of their medication could complicate their issues. So you don't want that for your patients. Now, let's talk about potential complications that can arise from a heart attack that is not properly managed. Now we have arrhythmias, we have heart failure, cardiac arrest, cardiogenic shock, or even sudden death. This can happen because when there is less oxygen supply to the heart muscles. The heart muscles will die, and because the heart muscles are dying off, there will no longer be enough strength to push blood to other parts of the body. So this patient is going to have heart failure, which could potentially lead to death of this patient. That will be the end of our lesson for today. So if there's any other topic you want me to talk about, let me know in the comment section and I'll do a video on that. Thank you.